Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating study published in the Journal of Veterinary Internal Medicine in 2024. This research, conducted by Lisa Stamolier and colleagues, explored the intricate relationship between hyperthyroidism and blood pressure in cats, specifically examining how radioiodine treatment impacts this relationship. As many cat owners and veterinary professionals know, hyperthyroidism, a condition characterized by an overactive thyroid gland, is a common ailment in older cats. One of the frequent concerns associated with this condition is systemic hypertension, or high blood pressure. Previous studies have reported that a significant percentage of hyperthyroid cats, ranging from 7% to 48%, also suffer from high blood pressure. While it might seem logical that restoring normal thyroid function would resolve this hypertension, clinical observations have suggested that this isn't always the case. In some instances, high blood pressure persists even after successful treatment, and in rarer situations, it might even develop for the first time following therapy. Understanding these blood pressure dynamics is crucial for managing hyperthyroid cats effectively. High blood pressure, if left untreated, can lead to damage in various organs, although this seems to be less common in hyperthyroid cats compared to other causes of hypertension. Therefore, routine blood pressure monitoring is often recommended as part of the diagnostic workup for hyperthyroidism. Interestingly, hyperthyroidism in humans also often leads to an increase in systolic blood pressure, the top number in a blood pressure reading, while the diastolic pressure usually remains within the normal range. In human patients, successful treatment of hyperthyroidism typically leads to the resolution of this high blood pressure. Given this, veterinary researchers have sought to understand why the blood pressure response in cats after hyperthyroidism treatment might differ. Previous studies investigating blood pressure changes in hyperthyroid cats after treatment have primarily focused on medications like methimazole or carbimazole, sometimes combined with surgical removal of the thyroid gland. However, there has been limited research specifically examining the impact of radioiodine treatment on blood pressure in these cats. Furthermore, it remained unclear whether factors like the development of kidney issues or iatrogenic hypothyroidism, which can sometimes occur after hyperthyroidism treatment, played a role in the persistence or development of hypertension. Another intriguing aspect is the behavior of cats with hyperthyroidism. These cats are often described as hyperactive, irritable, anxious, or restless. This raises the possibility that some of the elevated blood pressure readings observed in hyperthyroid cats might be due to stress and excitement during veterinary examinations, a phenomenon known as situational or white coat hypertension. This study aimed to address these questions by investigating a large group of non-azotemic hyperthyroid cats before and after they underwent successful radioiodine treatment. The researchers specifically wanted to determine the proportion of these cats with high blood pressure initially, whether this high blood pressure resolved, persisted, or developed after treatment, and if there was any link between post-treatment blood pressure and the development of kidney issues or hypothyroidism. They also considered how the cat's demeanor, whether calm or nervous, might influence their blood pressure readings. Now, let's move on to the results of this comprehensive study. The initial evaluation included 401 cats with untreated hyperthyroidism. The researchers found that 27% of these cats had systolic blood pressure measurements of 160 millimeters of mercury or higher, which is the threshold for defining hypertension in cats. Interestingly, a higher proportion of cats that were noted to be nervous or excited during the blood pressure measurement were also found to have high blood pressure compared to calmer cats. Following successful radioiodine treatment, a subset of 255 cats were re-examined approximately 6 months later. Among the cats that were initially hypertensive, about half, or 49%, saw their blood pressure return to normal after the radioiodine therapy. However, 51% of the initially hypertensive cats remained hypertensive. In cats that had normal blood pressure before treatment, a small proportion, specifically 9.5%, developed high blood pressure for the first time after successful radioiodine treatment. The study also looked at the potential influence of kidney function and thyroid status after treatment on blood pressure. They found that persistent or newly developed hypertension was not significantly related to the development of azotemia, which indicates kidney dysfunction, or iatrogenic hypothyroidism, which is low thyroid hormone levels caused by the treatment. Notably, a higher percentage of cats that remained hypertensive after treatment were also described as nervous or excited during the examination, similar to the findings before treatment. When comparing the findings across the 3 veterinary centers involved in the study, some interesting differences emerged. The centers in Europe reported a substantially higher proportion of cats with hypertension before treatment compared to the center in the United States. The European centers also reported a higher prevalence of nervous or anxious cats. Similarly, after treatment, the center in the United States had a lower prevalence of hypertension and nervous demeanor compared to the European centers. Finally, the researchers examined whether the severity of hyperthyroidism before treatment was linked to blood pressure. They found that cats with more severe hyperthyroidism tended to have slightly higher systolic blood pressure compared to cats with milder disease. However, this association was not very strong. Now, let's delve into the discussion of these findings and their implications. The study's finding that about a quarter of untreated hyperthyroid cats have hypertension aligns with the mid-range of prevalence reported in previous studies. The observed differences in hypertension prevalence across the different study centers highlight the potential influence of the clinical environment and the cat's stress levels during blood pressure measurement. The higher proportion of nervous cats and higher blood pressure in the European centers compared to the quieter, feline-only clinic in the United States strongly suggests that situational hypertension plays a significant role in the apparent prevalence of high blood pressure in hyperthyroid cats. The fact that only about half of the hypertensive cats saw their blood pressure normalize after successful radioiodine treatment contrasts with the typical resolution of hypertension seen in hyperthyroid human patients. This suggests that other factors beyond just the elevated thyroid hormones may be contributing to hypertension in some hyperthyroid cats. The relatively low rate of new hypertension development after radioiodine treatment at 9.5% is noteworthy. This percentage is even comparable to the development of hypertension in a population of apparently healthy older cats. This indicates that radioiodine treatment for hyperthyroidism does not commonly lead to the development of new, persistent hypertension. The study's finding that persistent or new hypertension was not linked to post-treatment azotemia or iatrogenic hypothyroidism is important. This suggests that these common consequences of hyperthyroidism treatment are not primary drivers of ongoing blood pressure issues in this population. The consistent observation that nervous or excited cats had higher blood pressure both before and after treatment strongly supports the idea that situational hypertension is a significant factor. This could also help explain why the resolution of hypertension after returning to a normal thyroid state is not always complete, as the underlying tendency for stress-induced blood pressure elevations may persist. Furthermore, the fact that none of the cats in this study with a systolic blood pressure of 160 millimeters of mercury or higher showed evidence of retinal damage, a common sign of sustained hypertension, further supports the notion that much of the observed hypertension in hyperthyroid cats might be situational. The researchers acknowledge some limitations to their study. The use of multiple operators across different centers for blood pressure measurements and demeanor scoring could have introduced some variability. Additionally, the classification of cats as hypertensive based on a single blood pressure measurement session, while following initial American College of Veterinary Internal Medicine guidelines, might not fully capture true sustained hypertension, which is ideally confirmed over multiple occasions. However, they note that a significant proportion of the initially hypertensive cats did have follow-up measurements, strengthening the conclusions. In conclusion, this study provides valuable insights into the dynamics of blood pressure in hyperthyroid cats treated with radioiodine. The findings suggest that while a significant proportion of untreated hyperthyroid cats have high blood pressure, much of this may be influenced by stress and excitement during examination. Successful radioiodine treatment leads to the resolution of hypertension in many, but not all, affected cats, and new hypertension development is uncommon. Importantly, persistent or new hypertension does not appear to be linked to the development of kidney issues or low thyroid hormone levels after treatment. The strong association between a nervous demeanor and higher blood pressure underscores the importance of considering situational factors when assessing blood pressure in hyperthyroid cats. The researchers propose that hyperthyroid cats may be predisposed to stress-induced hypertension rather than true pathological hypertension. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.